Okay, hi everybody. Welcome. We are here tonight to talk with Dr. Elissa Hellman, who is of the Confident Kala. I can't wait for her to talk to you all about her work, tell you what a Confident Kala is, because I think a lot of you maybe don't even know that, and to really discuss what it feels like being an OBGYN on the other side of the table, having to deal with patients who have infertility and loss and thinking about how to deliver bad news, how to best support them in their different struggles and all of these different pieces. So I'm really thrilled to have her here tonight. Let me grab her. Let me see where she is. One second. Okay, let's see. She should be here in a second. Okay, and we got a couple of questions, but if any of you have any questions that you'd like us to answer, like her to answer, so please send them our way so that we can address them tonight. Okay,
Hi.
great. And she's here.
All right. Hi.
How are you?
Good. How are you? I'm so glad we're finally doing this.
It feels like it's been like 12 million years in like preparation, right?
Totally. Yes. We're both busy.
Okay.
It's totally cool.
You know what? It's all good. It's all good. Okay, so I am not going to be as good as introducing you as you are as introducing yourself. So please introduce everyone, tell everyone who you are, but also tell everyone also like what is a confident kala? Because I think like some people don't know what that means, and I want them to understand your work, and then we'll move into some other stuff. So please go.
Sounds good. All right. So my name is Elissa Hellman. I kind of wear a lot of hats these days. I am a general OBGYN, so regular like do pap smears, treat yeast infections, breast exams, and deliver babies. And, you know, of course, with the obstetrics part of it and the gynecology part of it too, does come a lot of experiences with, infertility in my patients. So we'll talk about that for the rest of the time. And then I also, I have a telemedicine practice. So that's more virtual as opposed to my regular job, which is in person in the office. And that is a practice where it's geared towards Jewish Orthodox women who practice the lifestyle that Orthodox Judaism has laws for when you can have sex, what, in relation to bleeding and menstrual cycles. And there's a lot of issues that come up with that because not everyone has a perfect cycle and, perfect experiences all the time. So,
Anybody, nobody has a perfect like 28 days. Like
for sure. So there's a lot of issues that really kind of like come up with that where, I can't be bleeding, I can't be spotting. And you go to your regular gynecologist who's not really aware of these things. He's like, what's the big deal? It's just spotting. Like it's nothing. So I get it. Cause like, hey, I'm an Orthodox Jew, I'm married, like I get it. So I kind of combine those two like parts of my life of like, well, I'm a gynecologist, so like I can help you medically. And I totally understand what you're saying. It doesn't sound weird to me. I know what your priorities are. And I do that. And so I named my practice the Confident Kala. So what does Kala mean? Kala in Hebrew means bride. And generally, women getting married in Orthodox Judaism start to learn about all these laws because it's really only applicable to a sexual relationship. And in Orthodox Judaism, I guess, ideal is that you wait until marriage for sex, whether that happens or not, which for sure does not all the time, which I totally understand. But that's when everyone's learning. So I kind of, a kala would probably want to start having a conversation with someone like me who understands about like, hey, I don't want to be bleeding during my wedding and vacations and things like that. And I really feel like my mission, I guess, as a doctor, not even a Jewish doctor, but a doctor, is that everyone should understand their medical choices and understand like what's right for them and not just say, hey, oh, this person's an Orthodox Jew, they don't want birth control or they don't care about this, and like allow someone to have all the information, have all the choices, and then make the one that's right for them. And that's where that confidence comes in of like, hey, I'm taking control of my women's health, my medical health, and be confident in that. Yeah.
I love it. I love it. I love everything about it because we as women want to, I mean, I think also in today's day and age, also with the advent of Google and everybody can sort of find out any information they can, there's a lot of sort of mystery surrounding this, like, I need my cycle to be like this, or I want to, only choose that, or I want to, and when you understand more of what is the reason behind it and what your choices are, then you can make a better decision for you in your life. So I love it.
Sure. Yeah.
I love it. Okay, so let's sort of jump into the topic.
Wait, I'm just going to interrupt you and say that I love what you're doing, and I'll tell you. Wait. I'm not going to stop. I'm taking over. And I just want, so when I haven't, like, I'm new to Instagram. Like, I'm old. I have no clue about the social media thing. I know we're like the same age, but
I would say you and I think I'm actually older than you, but we won't discuss that here. A lady doesn't tell her age, right?
That's good. But I started on Instagram with the Confident Chiropractic. I don't need Instagram for my actual telemedicine practice, but I started as like the education piece of it. Just so maybe people have like a little background, and then they make an appointment with me and they're like, oh yeah, I remember you talking about things like this. So, and I was just on Facebook, like, child of the 80s, like, you just post your family pictures. That's all I do on Facebook, right? But Instagram, I felt like, had the younger population that I was kind of like interested in getting my information out to. And then, like, boom, like, oh my God, there's this like amazing community that I did not know existed, of like all this infertility support. And I was just really blown away. And I'm like, I learned so much from you, which we will talk about. But so that's like a huge thing for me, of like, Instagram was really like just eye-opening as far as like what is available to help people that like I can't always provide. So yeah.
Okay. Yeah.
Had to say it.
About the infertility community at large. It's amazing.
Yes.
The truth is that I very much, like, the reason why I chose Instagram as the space that I wanted to deliver this message of this. I wanted to bring this nonprofit. I wanted to bring this support to the Jewish community at large for anyone who was struggling. I chose Instagram specifically in the same way that you did, because this is where the community is, the 20 to 40-year-olds, like, not the like old fogies like you and you already called yourself old, so I can call you old now also. I know I call myself old, but I was playing on Instagram well before this, and I knew what was out there, but I knew that there was nothing specifically for the Jewish community. So, okay, right. Now we're done with that. So look, I what I want to hear and what people have asked in their questions is, in your training, and as a pediatrician, there were times that I did a lot of work alongside OBGYN residents. In your training, what kinds of education and what kind of sensitivity were you given in regard to dealing with individuals who are struggling to have a child, or individuals who are having losses? Because, like, the practical sort of bread and butter of your work is dealing with people's sort of typical gynecological issues, and then the obstetric pieces of people getting pregnant, people wanting to be pregnant, birth control, like seeing them through pregnancies, and then the postpartum period. So talk to us a little bit about your training and what you did get, I guess.
Right. So, there's not a lot of sensitivity training. I'll tell you, the miscarriage, well, and I'll, there's two parts of this community, right? There's infertility and then recurrent miscarriage. So that's different when you talk about like sensitivities and conversations you have with your patients. But it kind of gets lumped into, this is just like a gynecologic diagnosis when you have infertility and you haven't had a pregnancy yet. If you've had a pregnancy and it's a first trimester miscarriage, again, kind of lumped into gynecology, right? Like Same procedures sometimes to gynecologic issues not related to any pregnancy. If someone has a second or third trimester loss and we're talking about delivery, um, you know, kind of all the same stuff, like technical stuff as obstetrics. So there's not like a specific, okay, let's talk about just infertility and miscarriage. Um, you kind of learn on the job as far as how to talk with patients going through these very like emotional situations. No one ever sits down with you and says, be nice, don't say this, don't say that. I guess there's an understanding like, hey, you went into this field, like if you want to do obstetrics, and you're not going to further specialize out of obstetrics, but if you want to do this, like you're probably like enjoying this delivery baby part, so you're probably going to be like all happy for your patients and go through that happy part with them. So of course, like when it's sad, you'll go through the sad part with them, and just assume that you socially are a with it person and can and can just kind of handle it that way. um that's not the case. I mean, it's definitely a learning curve of, oh, I think I said the wrong thing to that patient, like she just like didn't respond in the way I thought it was, right? Like you never would say anything like inappropriate, but it's definitely a learning curve, especially like in the office.
Do you think, so the question is when have you seen it, like in your training and in your years of practice, when have you seen it go wrong? Like what, like that you've noticed or you've observed other people, in practice and in situations, when have you seen it go wrong? Or when have you realized, oh, like that didn't, it feels wrong. Something
Right.
feels off. And I need to fix this because I'm walking away with this like very yucky, terrible feeling.
Right. So unless you say anything horribly inappropriate, which like people don't in these like sad situations, right? Like as far as the doctor-patient relationship, you don't see anything in the moment, really. It's more like afterwards, like, they've left or you're like thinking about it and you're like, I think I said, hey, at least you can get pregnant again, and that's something where like I've learned, like for me, the doctor, like, yes, you can get pregnant the second you look at your husband. That's great. That's a hurdle you have passed that from my medical perspective, I am happy about. Like, I know you're going to be back 3 months from now pregnant and we'll start over and we'll do what we can with that pregnancy. But like that could be really off-putting, right? As like, but I'm not pregnant now and I want this baby and I don't have it. So things like that, like they, at least like you can get pregnant, at least you can, at least you have a baby at home, like just go home and hold your baby. That doesn't make it better, right? So it's so like, hey, you're getting regular periods, that's great, like I'm so happy you're getting regular periods,
Right. And I think,
right.
like, I think for people who are listening to this, I think it's really important that you're sharing this perspective specifically because I'm going to take myself out of the medical profession as I'm chatting with you for this specific moment. But, and as a patient and as someone who's experienced both infertility and loss, if someone in the medical profession or my doctor had ever said to me, well, at least we know you can get pregnant, I think I might have left the practice. Like that might have been enough. But now putting my medical hat back on, I understand why that's actually a good thing, right? Like
Right.
it's a good thing, like practically speaking, when like I think what people understand is that doctors are not given the sensitivity training. It's not that they shouldn't have it, but because their brains work scientifically first, so the first things that they're thinking are, okay, she got regular periods, she got pregnant, okay, these are all good things. So that,
like I have a checklist that I'm like, great, okay, let's see where the problem is,
right, like
yeah.
it's because we're naturally sort of spinning those wheels and going through that checklist. We're thinking, practically speaking, scientifically speaking, this is actually okay. Like it's actually like, it's not so bad. and it's actually probably going to be okay. Nobody can guarantee you anything, but because you're checking all of those boxes in your head, you're like, okay, this is a woman that I'm probably going to see again, exactly as you just said, in 3 months. And I think that what I'm begging, and I think what you're doing also right now, what you and I are doing in this discussion is what we're doing is we're begging patients and saying, yes, we can do better. Like, and we're trying to do better. And we know that even though we've ticked all those boxes, we shouldn't actually say what the first thing that comes to our head. We should actually pause.
Think about it first.
Think about the person, think about the situation, and pause and be empathetic. But know that also in our heads, we're going through this checklist and we're not trying to be insensitive.
Right. Right. That is, yes. We're definitely never trying to be insensitive. It's hard. It really is. You know, and sometimes you just have to, especially like if you haven't experienced it yourself, or you don't have that, you know, personal, like I can talk to you about like feeling pregnant and the kicks and the discomfort, right? I've been pregnant 3 times. Everything went perfect. Thank God. Like I don't have that personal experience. And right, like you can't learn what it's like to have a miscarriage, right? Like you either have one or you don't. I never have, thank God. I'm like blessed beyond belief that that is the case. But it's when you don't know, you don't know. And that's why there is that learning curve, you know, and that's why, you know, if your doctor says something that's like off-putting to you, you can like nicely, right?
Yes.
Nicely be like, oh, that was like, that doesn't make me feel better, you know, and like that's okay. And that like brings that sensitivity. We'll never ever say that again to you or anyone else. You know, and now I'm kind of like, you just say, I'm sorry, like I'm sorry, I don't have better news for you. You know, I know this is not what you were expecting to hear today. Those are like my 2 lines. Because like I know, I mean, the minute I put an ultrasound in, I know, right? I can tell. And it's yeah, it's just like, okay, take a step back. Where are they right now? Are they like super worried? Are they super excited? Like, how do I have to be to like break the news? And it's like so important to think about what comes out of your mouth before it does.
Yes. Yeah. And as a person who has been on both sides in the sense that I've been the patient being given bad news and also can read the ultrasound, so know when there's bad news that's coming. Right. I immediately know. I immediately know. And the doctor also, or the tech also immediately knows. And we all know together. And it's, but it's still you, even though you're probably not even going to remember those first few words that are coming out of your doctor or the tech's mouth, you still want it to be one that sort of washes over you and you don't remember, as opposed to something that you do remember because it was so different than what you expected. And so look, so what I would say to all of you, I love what you said about how if someone says something to you that's off-putting, say something. Like you may not be in the space, in the emotional space at that moment to be able to come back and give your thoughts and your reflections, frankly, like, oh my God, I can't believe the person just said that. But I always recommend, I have many discussions with people about this. Like I always recommend either going back in your next appointment or even leaving a message with the office manager, like telling them what happened, because physicians and the medical staff, they need to know, because you don't want that to happen to someone else. Like you want, and because the training isn't happening in medical school and in any of these professional schools, it has to happen on the job. So please share it. Please tell us when something is happening that you're not comfortable with, please.
For sure. Yeah, definitely. Yeah, I mean, we all learn on the job in medicine, you know, like we get our hands-on medical training. We definitely do not get the social, emotional aspect at all.
Correct. So, and I think like the adage, there is this adage in medicine of see one, do one, teach one. And I think that very much, like I remember that it very much applied here as well, in the sense that you first watch someone deliver bad news or give you a difficult diagnosis, then the next time you do it yourself. And then the time after that, someone else is in the room watching you. And so then they can learn. Like, this is the way all of medicine is. It's see one, do one, teach one. There isn't a lot of training. It's a lot of it is on the job.
Right.
I mean, you, that was the way it was for you too, I'm sure.
Oh, for sure. Yeah. Remember, we're both old.
Yeah.
No, it's like I do think I'm hopeful. I think there's a lot more sensitivity training in medical education these days, not just in infertility and this field, but all over, like cultural sensitivity and like different languages if people don't understand. So there's definitely, I think, more of that. But at the end of the day, you can't always teach it. Even if there's a lecture, even if there's a PowerPoint, like you just have to experience it and try to be as like socially appropriate in the situation as you think you can in all fields, you know. So
Ella, do you ever remember, and I'm sure there are many times that this has been the case, but do you remember cases that sat with you, that patients that have sat with you and sat with you emotionally, where you came home and you were like, oh my goodness, like I can't believe that this happened. Like I want to hear a little bit more also about like how you personally deal with difficult cases, how you recover from that, how you go back to work. Like tell us a little about that too.
yeah, so I mean, I definitely have a few patients that I like will never ever forget, and like who taught me a lot and just really stuck with me. You know, unfortunately, first trimester miscarriage is extremely common, right? Well, actually, let me start with infertility because that's even before we get to miscarriage, right? So, someone who's having a really like hard time getting pregnant is so frustrating for me. And so, I mean, of course, frustrating for her, right? I'm trying to be
Right.
sensitive, but like from my perspective, like I'm doing whatever I can, but I'm like at a certain point, I am done, right? Like I'm not an infertility doctor. I can give some Clomid or Letrozole. I can do like an initial workup, but like if nothing's working, like I can't do anything. And I feel awful, like so bad. It's been a year, it's been 2 years. Like hopefully they've been to an infertility specialist by then and like something, but like sometimes I remember these people, I'm like, I haven't seen them. Like hopefully they moved away and they're now pregnant with their, you know, with their baby or something, you know? So that's kind of like a medically frustrating part for me. Not frustrating enough that I'm going
Right.
into infertility, but it's that's hard and just like I can't help you. I'm your doctor. I'm supposed to help you and I can't help you. So that's annoying. As far as like a first trimester miscarriage goes, unfortunately, so common. And there's times of the year also, like I feel like seasonally, there's also like a time when like half of my new OB patients will be miscarriages, and it just like one after the other after the other, and I'm like, oh my god, like what is going on? And like you try to blame it on this or that, and of course there's nothing to blame it on, right?
Right.
Everyone's different. You know, so like that fifth, sixth, seventh one in like a month, you're like, what is going on? You know, it feels weird. Um, and then, you know, there's this, the second and third trimester ones, I think are more visibly emotional. I think, you know, when you've already been to a few appointments, you've already heard a heartbeat, and then like all of a sudden you just don't. And this woman walks in like petrified, as opposed to walking into your first appointment, assuming everything's fine, and then it's not. But knowing that like she has this intense fear, um, you know, knowing that she had a baby who was alive and now maybe not, um, those are horrible. Like those, like, you know, the day after, I'm just like not in a bad place, but like just like in a funk. You know, it definitely affects me. Like it's still my job. This is what I do. You know, so it's not like if I took home every bad thing that happened during my week, like I couldn't really function, right? Like there's a point when like you have to kind of, that work stays at work, right? And then you come home and you're like, I'm so happy to like hug my children at night, you know, like it just makes me a lot more grateful for what I have and grateful that I didn't have that experience. Um, but like if it made me fall apart, like I wouldn't be, I think, like as good of a doctor, right? Like I have to be strong in this situation. I have to handle it medically. Like I can't fall apart in the room. Have I cried like with the mom, like with her baby in her hand?
That's actually one of the questions that we have.
Yeah.
Someone wanted to know how many times, or if you've ever cried with a patient.
Oh, totally. I had one patient who was incredible. She came to me after she had 2 healthy babies, came to me as a new patient. I delivered her 3rd baby, totally fine. And then went on to have, like, desperate for her 4th baby, like just like that was her mission. And 6 first trimester miscarriages and 2 second trimester miscarriages, all in the past 3 years. And I'm like, she walks in with, I don't know, her 3rd or 4th, and she's like, it must be so hard for you to give me bad news. And I'm just like, oh my God. But can you stop talking now? Like, this is not what I wanted to hear. I'm like, I'm starting to cry before she is, because she's almost like expecting it at this point. And I'm like, come on, we're going to get a good one. We're going to get a good one. And then like 6 months ago, we delivered her 4th baby, and like tears everywhere, like happy tears, of course. But I'll tell you, those 2 second trimester ones, it was a 15 and a 19 week, and no great reason, right? Like, did all the workup, couldn't find anything. And delivering those 2 babies was like not a happy thing at all. I mean, we were just all of us were bawling in the room. So yeah, I do. I mean, I'm not crying with someone's like first trimester miscarriage. Like I definitely don't have that like emotional response, but it's those patients who've had like,
I was gonna say, and I think if you did, and I mean, I'm coming at this from the professional angle, like if you did for every first trimester loss, then I'm not sure that you'd be able to do your job, because they're so common.
Right, for sure. You know, right, like I can't break down, right? It's and I'm not minimizing anyone's first trimester miscarriage, and I'll tell you that I did have one patient who had twins, then had another, like got pregnant again, super happy. First ultrasound was not good, diagnosed with a miscarriage. We ended up doing a DNC, that's what she wanted to do. And I was like kind of surprised by the, like, how bad she was taking it. Like I knew her already. She was a strong person, and like broke down. And I would never like show my surprise, because that's not appropriate. But just like couldn't get herself together in every appointment we had, like planning this DNC and the pre-op room, like really just falling apart. And so she was in the OR, and I was like just waiting for everything to start. And her husband goes to me, he's like, like she's never experienced grief before, like ever. She has all of her grandparents, all of her parents, none of her friends have ever done, like she's never experienced death before. And this is her first time losing something. And that's why she just is the way she is. And I'm like, that I never heard that perspective before, right? Like that really like hit me as, okay, someone can like have 2 kids at home, be like healthy otherwise, not be going through like major infertility issues for years, and have this regular first trimester miscarriage and fall apart. And that was a really great like sensitivity training for me of like, it's not up to me to decide when you should be super sad or when you should cry, right? It's up to you. It's your experience. I just have to like go along with it, Yeah, I think those are handled.
Yeah, I was going to say, I think that is that piece is so important, because you're 1,000% right. Like you as their physician, you don't know their backstory. You only know what you're presenting. You see someone's medical history, a little about whether they're married, they're not married, how many pregnancies it's been, et cetera, but you don't know their full life story. And so it's only a first trimester loss, but yet for this woman, it was something very different.
Right. Yeah. I've had people with, she had 1 kid, and then like 7 or 8 first trimester, like 4 to 6 week miscarriages, to the point where she walked into the office with every like 8-week ultrasound or 6-week ultrasound, like getting up on the table being like, I know it's not good. I'm like, what? Like, so flippant about it, but like that was like also like she had such acceptance that like she's just gonna keep trying until it works in such a like I guess academic way, or just like a just non-emotional way. And I'm sure she was emotional at home, but like when she came to me, she was like, yeah, it's like, I know it's not good. And was that like a mechanism for like when I told her, you're right, it's not, was that her way of like pre-coping? Probably, you know? So yeah, long story short, she ended up with 2 babies after that. But, you know, it's,
Right.
and that's amazing for me. I mean, that like, as someone who has sat there for years with someone going through like so much bad news, to then deliver their baby is amazing. I mean, those are the deliveries that are like, call me, even if I'm not on call, like I have to deliver her, you know, and those like make it better. You know, I don't know if it doesn't probably make her miscarriages better for her, but it kind of makes it better for me, not being the one experiencing the miscarriages, right? Like in my little doctor world, it makes it better for me.
Right. Look, I mean, that makes perfect sense, right? Because you want to be there for the good if you're going to be there also for the bad. Like you want to, on some level, sort of see it through, whatever that means. So
Right.
of course it makes sense.
Yeah.
Of course it makes sense.
Right.
It's like
my closure.
Yes,
you know?
you're close.
Yeah.
And tell me also, like, what are things like that you've learned to over time, like besides like the like don't say the at least, or don't say the yes I know, like you have regular periods, or you know, so on and so forth. Like what are some other things, like if you were speaking to other professionals in the space, like what would you say to them, or just a few other things of besides like your 2 things that you say to people, like, and I don't even remember what they were right now, but
I don't have good news. Sorry, I don't have good news. And like, I know that's not what you wanted to hear today or was expecting to hear. Right. So something that also I've learned along the way is, you know, you think everyone just like comes to you as a doctor and they want the information and, oh, I have a diagnosis, right? Miscarriage. What's the plan? You know, I know what the plan is. I can tell you what your choices are, but no one is hearing that, right? And so super, super important to be like, we can talk about this now. You're not going to remember anything I'm saying. I can talk about it briefly, but we're going to talk tomorrow, right? Like, go home, process. It may take longer than a day for you to process, but like, let's talk when you are hearing what I'm saying, instead of just like being with this wave of like sadness over you, right? So I really, like, you have to make that time as a doctor to be like, okay, I have a 20-minute phone call that is happening during lunchtime tomorrow, because that's the only way she's going to be able to hear what I'm saying, you know? So that I think is like super important when you're dealing in any field of medicine, when you're dealing with like bad news, like no one's hearing you, you know, for what your options are to then go forward.
1,000%. I love that. And I love the fact that you build it into your schedule. I mean, obviously it's your lunchtime, but you're building it into your schedule because you know that no one is listening, really listening at the time that they're getting bad news. Yeah, it's 1,000% right.
Right. And then, you know, something else I kind of learned along the way is, especially with recurrent miscarriages, and I know I'm talking a lot about miscarriage instead of like primary infertility, but you know, with the recurrent miscarriages, you know, if someone has one, I always offer, okay, when you're pregnant again, we'll do early blood work. You can come in for an early ultrasound. Like, people are just more anxious. So like, I'll give you the information you want. And then especially with my like recurrent miscarriage patients, they're like, no, thanks. like, I'll just come in at 8 weeks, like when you would see everyone. You know, sometimes like, I'm like, don't you want to know? Like, don't you want to know, like, from like as soon as you can, that it's like what it is? Like, because if it's not good, then will like take care of it so that you can get pregnant again. Or, you know, and that was like kind of my initial like response is like, I'm being all medical. I'm doing my checklist, right? Like, let's find out diagnosis, right? And to hear women be like, no thanks. Like, unless I'm like bleeding or have symptoms, like you'll see me at the 8-week visit. If it's good, it's good. If it's not, we'll deal with it. But I can't have that constant like checking blood work and going in for ultrasound. It's expensive, you know, which like you don't think about as a doctor, right? You're not like paying for it. I just order the stuff that's supposed to be ordered, right? And it's kind of eye-opening to say like, okay, it's okay for them. It's their experience. It's their pregnancy. It's their potential miscarriage. Like, who am I to say, don't you want to find out? Like, don't you have to know? You know, so that's another thing we kind of don't get taught.
Yeah, look, I think this all boils down again to something that we were talking about earlier, the piece about choice, right? Like, this is all about, that's your practice. That's your side gig, so to speak, this confident call-up to your practice, to your personal practice, in that you have choices, and let people make choices. And for some people, they want to know right away. Like, they need to know, they want to know, and you offer them that option. But others are like, no, like, no. Like, and that at the end of the day, like, there are so many things in life that you don't have to have a choice about. Like, they don't have a choice. And I personally would not have wanted that. I personally would have wanted all information, all on deck at all times.
You're also a doctor, right?
But correct. Right. But I understand perspective totally of someone who says, no, like, I can't handle that, and I'm going to find out when I find out. And like, that's fine for me. I think it's great. I think that you appreciate as a physician. Like, that's the most important thing.
Yeah, for sure.
Okay. So tell us, like, as we wrap up here, is there anything else that you would want to say to, you know, speaking of your audience, this audience, the community at large, about your work, things that are commonly misunderstood, anything else that you've been thinking about that you really want to tell people, like, hey, like, this is really the way it is, and whatever, X, Y, and Z?
Yeah. So, you know, one thing that I think is, you know, I see a lot of new brides, right? And everyone just assumes like, oh, I get pregnant like when I want, or, you know, right away, or whenever I go off birth control. And I always think it's important to factor in a conversation. We're like, yeah, that may happen, but let's make a plan now before we start worrying, right? So what I think is very important is like the whole education piece of it. So like, you're getting married, that doesn't mean that all we're going to talk about is like birth control or sex, or, you know, take your prenatal vitamins, right? It's also like, if you're not on birth control and you are having sex when you're ovulating, if you know when you're ovulating and you're not pregnant in like a year as a 23-year-old, like, go see someone. Like, I want that piece of information. I want that, like, those words to have been said to this woman who's younger and is assuming everything's going to be fine, you know, to like have that in her head. No one's ever told her that. Like, people come to me like a year later, like, hey, I've been trying to get pregnant for like a year. It's not working, you know, but why, you know, like, if you had that kind of like a plan in your head of like, okay, you know what, new patient to me, you're 38 years old, you want to start having kids, you're just going off birth control, preconception talk. I want to hear from you in 6 months if you're not pregnant, right? Yeah. Like, don't leave it up to you to like realize, is there an issue? Is there not an issue? Like, no, like, this is my plan for you. This is why you came to me to talk, right? Like, and especially even with people who've already had a diagnosis of infertility, this is what we're going to do. This is how far we can get. we can do lab work, we can do semen analysis, we can do imaging. I can send you to infertility doctor. They can do this, they can do this, they can do this. But we're at the beginning of this. But just know that if this doesn't work out, plan B, plan C, plan D, right? And I think that for people to have that like plan, even though they don't need it or hopefully won't need it, knowing that there's that plan is so helpful. And like educating people on what could happen, so what you should watch out for and what you can do if you're starting to be worried about it. And that just takes out so much of the guesswork from people going through something that they never thought they would be going through.
I love that. And I think it's look, this is just, you know, natural, so to speak, education of what a typical young bride or young individual should think about their fertility. They should know that it should be only, you know, if you know that you're having regular periods and you know that you're having sex at certain times around ovulation, like if things aren't happening, if you're not getting pregnant within a year, then there's a problem if you're a young bride. And right, to make that plan, I love that. This preconception counseling of, here's our plan, and you're going to reach out to me if there's an issue, or you're going to reach out to me if you're not getting pregnant. I think that's super, super, super important. Education is important. Knowledge is important. If we don't have that, then are we?
Right. And, you know, it's in a doctor's office, like physical office, like we don't get a lot of time. And I think a lot of patients get like really frustrated. The doctor didn't spend enough time with me. They didn't tell me this. They didn't tell me that. And, you know, what I love about my telemedicine practice is that I have longer appointments, and like I can go through all this stuff. Like I as you know, working somewhere else, like I am bound by my schedule and by appointment times, and it is really hard. There's so much information, and the more people learn about it on their own, right, like through social media or the evil Dr. Google, whatever it is, you know, people find out about it, and then they get like super annoyed at their doctor. Why didn't they tell me? Why didn't they tell me? Like, I can't go through all of infertility in 20 minutes. I can't. Like, it's just not possible. So yes, you didn't hear that from me. Right. It's really frustrating to know that like there's a bigger conversation out there, but I am constrained. I cannot sit and talk to you and hold your hand for an hour. I can't, right? So either come back, or like you had this, like ideally, like we've been talking about all these little things along the way, right? So that you know if something's wrong, and you say, hey, you know what, Dr. Hellman, I think it's time that I want to do like my ultrasound or an HSG or something, you know, like we don't have to have the conversation over and over, because we've been having it throughout in like an easy way, right? Continuous way. So I guess one thing I would say is like cut your doctor a little bit of slack. It's hard. We wish we could say more, and we wish we could spend more time, especially when it's like such sensitive and emotional issues going on. It's not always possible. So yeah, I guess educate yourself, right, as much as you can, so that you're armed to go in and like can be educated to have the conversation, you know. So
Absolutely. Okay. As we're just ending here, someone just asked, tell me something. Am I blurry to you? That's my question.
No, I can see you perfectly.
Okay. So you've been blurry for a while, but you know what, guys? The reality is that the sound has been okay. So when we put this up, and God willing, it will go up, it'll go to IGTV. What I recommend is that people, if it's bothering them, that people turn off the video and they just listen to the audio. And so we'll deal with it that way. Welcome to technology. Welcome to 2021. Right.
Happy Instagram.
Right. Sometimes things work and sometimes they don't. As we're winding down here, what I'll tell people is they should contact you if they have any questions to Dr. Elissa Hellman at the Confident Kala. This has been an absolutely incredible live with lots and lots and lots of information, giving people really sort of an inside view as to how doctors think in these kinds of situations, and what you really want and hope and wish for your patients. but that at the end of the day that you're human and you're trying your best. And so I think that this was a really beautiful perspective.
Thank you.
Thank you
so much for having
so much. Yes, and please just remind people where they can find you again.
Yes, so you can find me at my website, www.theconfidentcala.com, or which is spelled the same as my Instagram handle. You can book up an appointment if you want, all through either like the book now on my Instagram page, and my Instagram page is full of like super fun reels as inspired by Amy. And just like a lot of just like little snippets. I'm super unorganized when it comes to topics. Like, I just like whatever's in my head the day before. I'm like, oh, let's do that. So I try to do a nice mix of OB and GYN. I actually got some comments like a few weeks ago, like, you don't do OB a lot. And I think part of that actually came from like, well, like, I feel like there's not a lot of GYN out there from a like Orthodox Jewish perspective. Like, that's really what I want to put out there. And also, like, I'm not just OB centered, right? So I kind of do like 60-40 maybe, like GYN OB. Yeah, so Facebook, Instagram, my website, all totally available.
Okay, amazing. And I just have to say, personally, I also learn a lot from your stuff. So even as a patient, so I also learn a lot. So it's great. It's great. I love all your stuff. Okay, guys, have a wonderful night. Dr. Hellman, thank you so much. And God willing, this will save. God willing. We'll see you in a minute.
Awesome. All right. Thank you so much.
Okay,
Bye-bye.
take care.